Matt Smith.
Okay. I'm just going to check your ID band, Mr. Smith. Perfect. Okay, Mr. Smith, so I'm going to take your blood pressure today, your temperature, and a few of your other vital signs. We're also going to check your body from head to toe. Is that okay with you?
Yes.
Okay, perfect. So let's get started. If you have any concerns throughout, please just stop me and I can address them. Okay, temperature's good. Okay, I'm going to put this on your finger. Perfect, thank you. And you could just rest your hand down. Okay, if you could lift your arm up for me. Good. Okay, you could leave it up like that. Great. Okay, you're going to feel the cuff get a little tight in your arm. Let me know if you have any discomfort. Okay, blood pressure is perfect, 110/70, very nice. Take this off. Okay, your oxygen level's great, 99%. And I'm just going to use your wrist. Let's check your heart rate. Okay, everything is right where we want it to be. Good. Do you know where you are right now?
Yes, in the hospital.
Okay. And do you know what day and what year it is?
Monday, 2021 is the year.
Okay, perfect. I'm going to just start by looking and feeling your head. Any trouble hearing?
No.
Okay. I'm going to shine a light into your eye. Just look straight ahead. Good. Get on the other side. Perfect. Can you open your mouth for me and stick your tongue out nice and wide? Good. And lift your tongue up, please. Good. Any mouth trouble, dental pain?
No.
Okay, good. Okay. Just going to feel your arms. Good. I'm going to do the same on this arm. Okay, you're going to squeeze my hands with your hands. Just give them a good squeeze. All right, very good. I'm going to have you close your eyes for this next part. Where do you feel me touching?
Left hand.
Okay. Where do you feel me touching?
Right arm.
Okay, perfect. I'm just going to move your arm. Any discomfort, any pain as I'm doing this?
No.
Okay. That feels normal.
Yes.
Okay, we're going to do the same thing on your right arm. No trouble bending your elbow there?
No.
And when we move your arm and your shoulder. That feels okay?
Yes.
Okay. Perfect. Okay, so I'm going to take a listen to your heart now. Okay, I'm going to start listening to your lungs. I'm just going to pull this down a little bit. Thank you very much. Okay, take a deep breath for me. Good. Again. And another. Good. Good. Mr. Smith, can I have you just sit up in bed? Is that okay? I'd like to listen to your back to hear the lungs. Okay. So deep breath again. Another. Again. Okay, I'm going to move these pillows out the way. You can lay back and you're going to be flat. Okay, good. Okay, next I'm going to look and listen to your abdomen, okay?
Okay.
All right. Let's take a listen first. Any trouble moving your bowels?
No.
Okay, any difficulty going to the bathroom to urinate?
No.
Okay. Everything sounds good. I'm going to lower your blanket. Is that okay?
Yep.
So I could expose your legs and your feet. Let's take a look at those. Okay. No swelling, so that looks good. Both of your pulses in your feet are nice and strong. Good capillary refill. Okay, you're gonna push up against my hands. Try to pick your feet up. Perfect. Okay, I'm gonna have you close your eyes. Perfect. Where do you feel the touch?
Right foot,
Where do you feel the touch?
right knee,
Where do you feel the touch?
left knee.
Perfect. All right, Mr. Smith, get up very slowly. I'm gonna have you just walk a few steps right beside your bed. Okay, just walk to me. Good, and walk back the other way. Okay, perfect. Let me get your pillows. Okay, why don't you get back into bed? Okay, let's cover you up. Okay, so Mr. Smith, the last thing I want to do with you is just a little bit of teaching. So I know the doctor told you you have elevated cholesterol. Now, while this is a concern, I don't want you to be too alarmed, but I want you to know that there's a few things you could do to deal with the cholesterol. So right now your weight is very good. You want to maintain that weight. A BMI of 24, which is what you are, is good. You want to always be within 20 to 25. So being that you're 24, you're close to that end of the BMI scale. So we want you to maintain your weight. I want you to start eating less fatty fried food. Have you been eating a lot of that?
Yes.
Okay, so we want you to cut out a lot of it, maybe just special occasions. Things that are not fried, things that are not fatty. Try to avoid red meat, try not to have a lot of shrimp, and that in itself should probably help a little bit. Also, we want you to have plenty of fiber. You can get that in fruits and vegetables. Whole grains are very good, and you want to have healthy fats such as avocado or olive oil. So the diet, along with you maintaining your weight, is essential, but you also need to exercise. So we're recommending about 30 minutes of cardiac activity. So some sort of cardio exercise such as walking, running. A lot of people like to walk, especially this time of the year, but you want to do 30 minutes, 7 days a week. If you can do all 7, if not, a minimal of 5 is good. And the doctor is going to see you back in 3 months so we can redo your blood and see what your cholesterol level is. How does that sound?
Okay.
All right, so in your words, can you tell me what you and I just discussed, just to make sure you fully understand it?
Should be eating healthier, less fat and fried foods, exercise more, and follow up with the doctor in 3 months.
Perfect. Any questions, Mr. Smith, over anything that we went over today?
No.
Okay. Well, it was so good taking care of you, and if you need anything, what I'm going to do is I'm going to give you the call bell. You could use this to get us. Should you need anything, please don't hesitate. It was so good seeing you, okay? All right.